looks like we're just about ready to get started. So thanks everyone for hanging with us for a few minutes of technology integration. Here we are at the wonderful Los Angeles Medical Center campus. We are ready to kick off the March meeting of the Health Innovation Community Partnership. As a reminder, this meeting is available in English and Spanish. So if you are joining us via Zoom, please select the language of your choice via the menu bar at the bottom of the screen. If you're in the meeting room with us, of course, we have headsets available for you at the check-in desk. Are we good to go? All right.
Oh, just saying that next slide.
Got it. So as a reminder, we are recording this meeting and it will be available on our HICP LA website in about a week's time. We, as always, want our conversations to be very interactive between our wonderful set of presenters and our meeting participants. So please always feel free to raise a hand, to put a comment or a question in the chat, and we will definitely call upon you at the right moments in time. So we look forward to a lot of rich dialogue around our wonderful presentations today. So let's go ahead and get started. Moving on, taking a look at our agenda. Today, we will have an update from the Los Angeles General Medical Center. We will have a report back on our Community Benefits Agreement Steering Committee related to the Centennial Project. There will be a community health update. We have a presentation from our colleagues at Metro about the Los Angeles General Medical Center Metrolink Commuter Rail project. And then we'll conclude our conversation today with some updates on campus projects, specifically the Restorative Care Village 4 and 5. And of course, at the end of the meeting, we'll have time for partner announcements. So if you have anything you want this body to know about, please make sure you have your conversation materials and comments ready by the time we get to partner announcements. As we begin, I'll go ahead and read aloud the meeting guiding principles. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious, and seek to understand various points of view. Participants will explain their reasoning and intent, share how we reach our conclusions, so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. So those, again, are the guiding principles for the Health Innovation Community Partnership as we developed them back in 2017. So here we are rolling into our 9th year of operations. Very exciting, but to see that our body has held firm over these many years, bringing this conversation and dialogue to the community partners so that we can have that rich conversation about what's happening on this campus and in surrounding neighborhoods. With that, we will move on and invite Halina Szymanski, a dietetic intern from the USC Masters of Science in Nutrition, Health Span, and Longevity, who's going to be speaking with us about how to eat better, be healthy, be healthier. So please come on up, Halina.
Hi, thank you. As she said, my name is Halina Szymanski, and today I'm going to be speaking about eating to reduce inflammation. Okay. So I'll just start off by talking a little bit about who I am. Like I said, my name is Halina. I'm currently a student at the University of Southern California. I'm in the Master of Science in Nutrition, Health Span, and Longevity program. I'm currently a dietetic intern here at LA General Hospital. Every Tuesday, I attend the Healthy Nutrition and Exercise class, and I also assist in the Edible Healing Garden. Next slide. So before we get into our topic today, I just wanted to mention that March is National Nutrition Month. And the theme this year is Discover the Power of Nutrition. And so National Nutrition Month is just an opportunity to create conversations and for people to learn a little bit about nutrition, um, and its impact on our health and overall quality of life. So as I mentioned, our topic today is eating to reduce inflammation. So to start off, what is inflammation? Inflammation is the body's natural defense system. So it's a protective mechanism. It occurs when the body responds to harm. And that can be in the form of injury or infection from bacteria, viruses, or anything like that. It is a normal part of the body's healing process, so it's not inherently bad. And signs can include redness, swelling, heat, and pain. There's two types of inflammation: acute inflammation and chronic inflammation. So acute inflammation is something you'll typically see if you get a paper cut or if you fall and scrape your knee. The injury site is going to be red, swollen, painful, and that is acute inflammation. It happens right after the injury or infection, and it helps start the healing process. It also usually resolves quickly after healing. The other type of inflammation is chronic inflammation. And this type of inflammation occurs continuously, even when there's no threat to the body. So there's no danger. And while acute inflammation is helpful for healing, chronic inflammation is actually detrimental to the body, and it causes damage to the body over time. It's actually linked to many chronic diseases as well. So why is chronic inflammation important? Why are we talking about it today? Like I mentioned, chronic inflammation is linked to many chronic diseases. Many that you have probably heard of, are probably familiar with, are heart disease, high blood pressure, type 2 diabetes, certain cancers, autoimmune diseases. So that can be rheumatoid arthritis, lupus, anything like that, as well as Alzheimer's disease, dementia, and cognitive decline in general. So what causes this chronic inflammation? Diet and lifestyle factors can influence inflammation. And what we'll mostly be talking about today are the diet factors. So diets high in processed food and added sugar increase inflammation in the body. Other lifestyle habits that you are probably familiar with are smoking and excessive alcohol use, lack of physical activity, chronic stress, poor sleep, and excess body fat. All of these things can increase inflammation in the body. And so, like I said, we'll be talking about the diet factors primarily today. So some pro-inflammatory foods that you see often and you probably consume are sugar-sweetened beverages. That could be soda, energy drinks, a big sweet Starbucks or Dunkin' coffee in the morning, anything like that. Refined carbohydrates are also known to be pro-inflammatory. So that would be white bread, white rice, also pastries or sugary cereal. Processed meats are known to be pro-inflammatory foods as well. That would be bacon, deli meats, sausage, and then any highly processed snack foods. So chips, candy, anything like that that you typically see at the grocery store tend to be highly processed. And then any fried foods or fast foods. So McDonald's, Jack in the Box, all of that tends to increase inflammation. But something that's important to note here is that we don't need to remove these foods from our diet completely. A lot of these foods we enjoy eating. So the goal here is really just to limit the intake of these foods and at the same time increase our intake of anti-inflammatory foods. So what are anti-inflammatory foods? So these are going to be your typical whole foods like fruits and vegetables, beans and legumes, whole grains, nuts and seeds, fatty fish like salmon, sardines, and tuna, olive oil, and herbs and spices. And you might have noticed on this list, all of these are whole foods, typically fruits and vegetables that come from nature and that you buy whole at the grocery store. As I mentioned on our pro-inflammatory food slide, we want to avoid the processed, pre-made, pre-packaged foods and instead look for whole, fresh foods. So we've been talking about these pro-inflammatory and anti-inflammatory foods, but what does a day of anti-inflammatory eating actually look like? So I'll give you an example of what you can eat for each meal for a day if you want to focus on anti-inflammatory eating. So for breakfast, you can do oatmeal with berries and walnuts. This can be blueberries, strawberries, raspberries, blackberries, anything that you enjoy. Berries are particularly good anti-inflammatory foods. And I listed walnuts here, but any type of nuts that you like can also work. You can think almonds, cashews, anything like that. And then for lunch, we could do a veggie burrito bowl with brown rice, black beans or pinto beans, and then maybe some grilled veggies like onions, bell peppers, and some avocado and maybe salsa on top. And then for dinner, we can do chicken or even salmon or another white fish, some additional veggies like roasted cauliflower or broccoli, sweet potatoes, and even a side of hummus. And when you're looking at this list, something to keep in mind and notice again is that most of these are whole foods, whole fruits and vegetables. We do have chicken as our animal protein, but again, not processed pre-made foods. So as far as snacks, I have a few ideas. These are some snacks that I enjoy that I think are easy to make and that you might enjoy as well. You can do veggies and hummus. You could do bell peppers, cucumbers, carrots, really anything that you like and dip it in hummus. Yogurt with fruit is also a great snack. Greek yogurt is great. If you do regular yogurt, I would recommend non-fat or low-fat. And then again, any fruit that you enjoy. And then a fruit and nut butter is also a good snack. You can do an apple and peanut butter, a banana and peanut butter, or maybe you like almond butter. Again, you can tailor these to your preferences, but these are some suggestions. And something I want to emphasize is that small changes can make a big difference. There's a lot of information in this presentation. I don't want it to feel overwhelming. I am hoping that all of you can just take one thing away today. Then you can take that home and decide to make one small change today, this weekend, next week, because these small changes really add up over time and can make a big difference in your health. So what are some small changes that you can start making today? You can replace those sugary beverages with water or sugar-free beverages. Maybe you like sparkling water or you like sugar-free sweetener. Any of that can work and you can add that instead. You can also choose whole grains instead of refined grains. So that would be whole wheat bread or brown rice instead of white rice or white bread. You can also swap out butter for olive oil or avocado oil. And then when you're looking for a protein source, you can choose beans, chicken, or fish instead of processed meats or meats like pork or red meat. So some key takeaways that I hope you take from today are that inflammation is part of the body's natural defense system. So it is a protective mechanism. It's not inherently bad. It only becomes bad when it is chronic in the body. And when that happens, it can increase the risk of diseases. And diet and lifestyle have a big influence on chronic inflammation in the body. As we were talking about, there are pro-inflammatory foods and there are anti-inflammatory foods. And like I said, we don't need to completely eliminate pro-inflammatory foods from our diets. A lot of us enjoy those, and we can enjoy those every once in a while, but we do want to reduce our consumption of pro-inflammatory foods and at the same time increase our consumption of anti-inflammatory foods. And like I mentioned earlier, these small changes can really make a big difference. So just think about one thing you can do today, this weekend, or next week. And, you know, as you make that change, those changes compile and ultimately can have a big difference or can make a big difference in the status of your health and your quality of life overall. And now we have some time for questions.
There we go. Hi, everyone. Do we have any questions for our presenter about how to eat more healthily to manage inflammation in the body?
The inflammation is produced in any area of the body, or sometimes it's specifically in some places?
Chronic inflammation will be generally within the body. Acute inflammation would be more in a specific place, and that would be if you get an injury or something like that. Like, say you cut your finger, you're going to have inflammation in your finger. But chronic inflammation is throughout your body.
Which we get the chronic through time and for illnesses, but for trauma, is that what you're saying? For trauma is where we just get inflammation that is temporary?
Yes, trauma would be more temporary inflammation, but the inflammation that we're focused on today is chronic inflammation because that is harmful over time and can increase your risk of disease.
A big stomach.
Oh. Yeah, maybe you could have a conversation offline. Yeah. Do we have other questions? Oh, the question in the chat?
Yeah, we have a question in the chat. Rema is asking, I have seen an increase in sparkling waters like LaCroix and Spindrift. Are they healthy alternatives?
Yes, those are great healthy alternatives. That's a great replacement for a soda, or if you're drinking other sugary sweetened beverages. I really like Spindrift or things like that, and they have no added sugars, typically 0 calories. So I would say those are a good alternative.
Another question from Angela is there a specific lab to collect that can diagnose chronic inflammation?
I don't know that there's a specific lab. I believe there's several different labs that would indicate inflammation. I don't know that off of the top of my head. That might be a better question for a doctor.
And guess what we have? A doctor.
I might be able to answer that. So there are a lot of labs actually that are related and can point to signs of inflammation. We typically don't use them because it's not like, for example, a hemoglobin A1C where you can do some, like hemoglobin A1C is what we check in diabetes. And in diabetes, we can tell you your hemoglobin is high, A1C is high, and we need to lower it. We tell you what to do to lower it, and then we can check it again and we see some sort of number that we want to see. With a lot of these, what we call inflammatory markers, we don't have a specific number that we're chasing after, which is why we typically won't use it to chase down a target number. What we say is rather what Halina has mentioned is that we want your kind of lifestyle to reflect things that have become anti-inflammatory, like foods, like exercise, all of which we know have been shown to lower the inflammation in the body. And I just wanted to comment on the trauma. I'm not sure if that meant like physical trauma, like an accident or a laceration or something like that, or okay, a fall. Yes, so that's temporary trauma as well. Lasting temporary. The body is very good at trying to heal itself, but you give it a better chance of healing itself when your body is in a lower inflammatory state. What I was going to mention about trauma is also that there's emotional and mental health trauma in our past. And we know that that actually leads to higher cortisol levels, which can lead to higher inflammation. So that's one link that when you mentioned trauma, I wasn't sure what kind of trauma you're talking about, but I wanted to throw that in as well.
Thank you, Dr. Carla,
you.
for chiming in and complimenting the presentation. Do we have other questions or comments? Okay, great. Then thank you so much, Halina, for joining us today. Thank you,
you.
Carla, for chiming in.
I actually also just wanted to say a quick thank you and a reminder. Thank you, Halina. It is March. Everybody started the year off right with New Year's resolutions. So I think this was actually perfect timing for us to continue that momentum, which is really what I wanted to do by bringing Halina here. Thank you so much.
That's right, National Nutrition Month. So let's all celebrate National Nutrition Month and maybe think about one small, easy change that we can make in our diets that might make us a little bit healthier in managing our health conditions. All right, with that, we're going to move on in the presentation. We're excited to bring forward two members of our steering committee for the Community Benefits Agreement process for the Centennial Program. That steering committee is a subcommittee of the Health Innovation Community Partnership, and super excited to welcome up Ari Gutierrez and Diego Rodriguez, who are two of our founding members of HICP and, of course, serving on the steering committee. Take it away.
Hi, thank you all. Well, we're all very busy. We're busy. Happy New Year. And when did that happen? Because we have been in meetings. So what I'm going to do is do a little recap of what this project is about. And, it really dovetails with the work of the Health Innovation Community Partnership and what the priorities are of this body and the projects that are going on in the medical campus and immediate surrounding community and how that affects. So these were as a reminder, these were the priorities areas that are important to this group and to the project. The Centennial Project, just to clarify that for anybody who doesn't know, is really the redevelopment, reuse of the historic General Hospital, and which is the big beautiful building that's behind us, and Art Deco building, and also what they call the West Campus, which is the area kind of that way behind State Street, between State Street and Mission. So there's lots of room there, and the community and the county, and especially Supervisor Solis, is very interested in maximizing the resource that we have in public property and how that can help our community in all of these areas. Next slide. So the planks in here literally looks like planks. Jobs, affordable housing being a biggie. And the jobs is not only in the redevelopment process, but also once things happen, if there's a new building and the new service, then how is our community benefiting from the hiring before it opens and then after it opens? And all of these other things are very important, which you can read right here. Next slide. So the CBA Steering Committee, the purpose was formed, I think it was in November, and we had a very short time to start meeting. We meet in the evenings, and I don't know exactly how many people, but probably 40 people who are somehow involved. And so what we're trying to do is create a legal document that would help guide the developers, current and future developers and operators, for the priorities of our community. And the priorities of our community have been expressed to us, the steering committee and this body, through community meetings. And so we have boatload of responses from community members, and all of those community engagement opportunities over the, you said 9 years, a lot of that had to do with this, has been compiled. It has been put into a report. There has been research at every level, but most importantly, at the community level. What would you like to see? What are your priorities and all that? So all of that is written, and now we're trying to move all of that into this new legal document that we're trying to create. So obviously, we're there to make sure that the communities, what they express they want it, makes it into that legal document. We are representing the community because we were there at the meetings, because we've been involved, and because in our own work through community leaders and community organizations that are part of all of this effort have those same priorities in mind. So that's what's happening in terms of the steering committee and what we're trying to work on. And we are past deadline. And so now we're bumping it up, longer meetings, more frequent. So that's what's happening. Next slide.
Saying that the wireless mic is louder. So if I just
Sure. You want to turn this one up? Okay. So can you get me next slide? So so this is all the advanced work that the steering committee has been working on, and we want to make sure that the priorities are clear and also up to date. You know, every day we learn more about what's happening, what are good best practices in other areas, and so we want to make sure that all that is clear. One of the challenges is that we are working not just for next year, or for the next 5 years or 10 years, but we're actually working for the next 50 years. That's hard. You know, we have to predict the future in a very unstable economic, political, and fast changing society. But we just need to make sure that our anchors are down and that our key priorities are expressed and written in this legal document. The next. So as I mentioned, our steering committee is acting as a proxy, as a representative of the community as a whole from different perspectives and specialties. There's people who are, you know, like myself, who works for the LGBT advocacy and certain rights and so on and so forth. But then there's all the other people who are advocates and knowledgeable on affordable housing, and other people who know all about job training and developing all of that. So, so we have, you know, the body of the steering committee that has been created is really experts in different areas, and we're coming together to all inform the work. There's also, just to be clear, a support staff that is helping people who know how to make this type of document, and lawyers and people who know this type of work. So we're not working, you know, blindly. We are being guided, but at the same token, we are representing the community. Next slide, please. So committee updates, I'm going to pass it over to Diego because he's been to every meeting, every time, all the time, and I've missed a few. But I can jump in if there's anything I want to express. Thank you.
Please do, Annie. Please do. So good morning. Diego Rodriguez from Alma Family Services. To Adi's point, we provide social services regionally, mental health services, parenting, housing navigation, etc. And it's been a privilege being in that space with other service providers, experts, advocates. I'll provide a few updates from where we are in this process, our current status, but also what happened last month in February. The committee has been meeting weekly, which reflects the strong commitment from members to move through this process thoughtfully. At this point, these meetings allow us to craft language, refine priorities, learn different elements more in depth to reach a meaningful community benefits agreement. Very important update is that the timeline has been extended through March 31st. And this extension allows the committee to continue this process and ensure that the final CBA reflects community priorities in a clear and enforceable way. We have also invited subject matter experts to inform our decisions, as we've heard. And I'll mention a couple of experts that have come and spoken to us. Another key focus is the ongoing community oversight so that the benefits negotiated are able to be monitored and there's enforceability, transparency, and accountability. And finally, one emerging idea was the creation of a campus-wide safety and security committee, for example, that would include community representation and help ensure safety strategies reflect the needs of those who live and work in the surrounding neighborhoods. Next slide, please. So what happened in February? We had several meetings in February. The CBA met to learn and to advance both the technical and policy components of this document. On the 5th, we hosted a virtual session focused specifically on environmental justice. This topic is especially important given the scale of this project. We invited two expert panelists, Roberto Carlos Torres from the San Francisco Environmental Department and Giselle Fong from Advancing Climate and Environmental Justice. And these discussions really helped us frame how environmental considerations intersect with equity and community health. Our discussions also included examples of ground leases, community benefits agreements, and other relevant county requirements, which has helped the committee understand what mechanisms already exist to secure commitment. One of the outcomes of these discussions was progress towards the creation of a CBA framework, which is essentially a structure that will guide the negotiation of specific elements. Another important area of discussion involved implementation and enforcement long-term. To Adi's earlier comments, we are working on something that will have an impact across many, many, many years. And that's why we have explored practical ways to ensure that both the developer and county departments are meaningfully engaged long-term. Overall, February meetings have helped us move the committee from high-level priorities towards board-specific language on mechanisms and structures needed to turn priorities into community benefits. Adi, do you have any other comments? Okay, I believe our update is, yes, complete. Thank you.
All right.
Thank you,
Thank you both so much. Do we have any questions for our steering committee members? Oh, looks like we have a question from Martha. Don't go too far, Diego and Ari.
Hi, good morning. My name is Marta Gonzalez from Clínica Romero.
Good morning. My name is Marta Gonzalez from Clínica Romero.
Mi pregunta para los miembros del comité es, ¿cuántos miembros de la comunidad hay en este comité?
And my question for you is, how many community members are part of this committee?
Yeah, I think we have a core representation, but then we also have alternates, so there's extra.
Yeah. So the steering committee was formed from this Health Innovation Community Partnership membership. People self-nominated into the committee. We have a committee of about 20 members. Every member represents typically an organization within the community, and then they have an alternate as well. So the membership is really drawn from this body, and I would say they all represent community in different ways. We have these two members here. We have representatives from inner city struggle, self-help graphics, East Side Leads, Public Council, the labor union. We have a representative from the Chinatown Economic Development Committee, and we have trying to think who else. So in any case, that is the membership. We're happy to share the membership list out with you. Yeah, Public Council and then Neighborhood Legal Services of Los Angeles.
And also, I just want to qualify that although I'm lucky that my day job lets me get away for a meeting like this, I am actually a volunteer. So I'm a member of the community and I work in the area. So I volunteer not only for my public, for the nonprofit that I'm associated with, but also for all the work that I do here. I do not get paid for this.
Yeah, so to qualify also, that is absolutely correct. This is not a paid position on the steering committee. It is volunteer time, just as participation in the Health Innovation Community Partnership here is as well. And we're extraordinarily grateful because I think the committee shared pretty eloquently the demands we are putting upon them in terms of their time commitment to drive this process forward. So thanking you both so much, not only for the time today, but for all the hours that led us to this moment. And I see here a comment. Many members are service providers at the complex. Our service providers here, and that is absolutely correct. Yolanda, who is a board member for Alma Family Services, absolutely correct. Many of the people participating in this steering committee know this campus quite well because they work here at the facilities, either in the campus, at the hospital itself, or at the wellness center. Next question.
Okay. Mi nombre es María Ponce de León. Soy promotora de salud.
My name is Mariel Ponce de Leon, and I promote health here in the community. I've lived in Coyote for more than 30 years. How do we receive the information as a community from you? Because I haven't received any flyer or document or to get to know what work has been done for our community. I'm really interested because in this area, the rents have gone up every 8 months or every 12 months. And we were not able to control that. We're really interested in knowing what the organization is doing to help our community. Thank you.
Yeah, thank you so much for those wonderful questions, both of them. And I'm first and foremost, thank you so much for caring so much about what's happening on this campus and wanting to know more. As we know, the process that we're in right now is the steering committee is helping draft a document. It's still in draft format. It's not finalized yet, so it's not ready to be shared out. But when it is, it will be a public document, and then it will be presented here to the Health Innovation Community Partnership as part of the process to let everyone know what's happening. The agreement itself will be a document with community priorities and community benefits and what the community wants to see happen here on this campus in partnership with our development centennial partners, who is the one that is going to be doing all of the construction work and also bringing in the financing to build the campus out. So it ends up being an agreement between centennial partners, the County of Los Angeles, and the community, which is represented here by the Health Innovation Community Partnership. So that is the goal of what we're headed to with our agreements and our documents. When they're finalized, they absolutely will be brought forward here to share with you. And then we're going to move into a very long process. It's going to take quite a long time to build brand new buildings onto the West Campus portion of the campus, as well as, of course, the rehabilitation work for the historic General Hospital. That work is going to begin this year, the rehabilitation work and some of the cleanup on West Campus. So we know that level of work is going to start right away, but the new buildings coming, being built out, that's a little bit longer term, and we don't have full timelines on that yet. But again, we absolutely know and believe me when I say there are many advocates who are from this community and know the pain you're talking about, and they bring those comments and those concerns and those needs forward at every single meeting.
Yeah, I just wanted to add an important thing. And, I hear you in terms of all these things are happening in our community and we're living it right now. But what I wanted to clarify is what this body and project is versus what opportunities there are within the community to advocate for all of these things. So this is not rather, let me just say that there are organizations that are part of this, Eastside Leads, for example, that is advocating on a daily basis regarding rents and things like that. So I would get involved with that project. They meet on a regular basis. They advocate about housing and affordable housing and all that. I should say we, because we have a representative on that community organization and helped form it. But there are community organizations that are working on specific things, and community members can and should. We totally encourage you to be more involved with that. And maybe that's something that we can help do as HICP, is once again, list all of these organizations and what their focus is, so that we can help engage community with them, with the organizations with which individual community members may want to be involved. But all of those organizations do inform the work that this small committee is doing for this specific project. And remember also that there's neighborhood councils and other community organizations that are government supported, like community councils or neighborhood councils, and with which you can still be involved and advocate to. And there's also city council members and other elected officials that we need to advocate with on all of these issues. So this is just kind of like a little small, tiny piece of the puzzle, and the rest of the puzzle we still have to work with. But there are many people working with the different puzzle pieces.
Yeah, thank you so much, Ari. Those are wonderful suggestions. Absolutely. The member organizations that are on this committee's work is going to, conclude within the next few months. That being said, there will be an ongoing public engagement process for this project forever, for the life of the project. And so to find those opportunities to get involved, I absolutely agree with Ari. That's a wonderful, wonderful note. And I think next time when we come back in April to present, we'll be sure to share out where we just again the framework that we're working from and some of the membership, so that you can understand and see where there are additional opportunities to engage. So we will make sure to do that. But thank you so much for the questions. I think we've answered the ones in the chat as well. So with that, we'll go ahead. If there's any more questions in the room. Okay, we will move on in our presentation in that case. All right. So next up, we have Lena Silver from Neighborhood Legal Services, who's going to be sharing with us a community health update related to Medi-Cal benefits, is my understanding. Lena, welcome. Thank you so much for joining us today.
Thanks for having me. Thank you. All right. So today we're talking about access to Medi-Cal. I have some slides on CalFresh, but I don't think we have time for them, but I'm going to highlight them for you so you can reference them later. And other changes to public benefits for immigrant communities in Los Angeles. And I'm from Neighborhood Legal Services, and we're the lead organization for the Benefits Access for Immigrants Los Angeles network. Next slide. Neighborhood Legal Services of Los Angeles County provides free legal services to people in Los Angeles. We have a general hotline you can
Lena, sorry to interrupt you, but we're having a little hard time hearing you in the room, in the physical room. Is it possible to speak up a little bit or turn up the volume on your microphone?
There's nothing I can do on my end, but I think you may be able to turn up the volume on your end.
Okay, we'll work on that. So just speak loudly to us and we'll
Okay,
try to
I'll
take care of it on
try.
this end.
I also couldn't hear you all very well, and I think other people in the chat said that, just FYI. Okay. We also, I think relevant to this community here, run the Countywide Health Consumer Center, which can help people solve problems with their health insurance, regardless of their income, deal with medical debt, and navigate insurance-based denials of treatment, etc. Next slide. Again, we're the lead organization for the Benefits Access for Immigrants Los Angeles network. We're a network of health navigators and promotores, CalFresh and health insurance enrollers, and we're the legal services provider that supports in legal cases that arise from the intersection of public benefits and immigration. This is our hotline and our website. We have a lot of materials and resources there, like trainings and flyers and a public charge page to help you answer questions in 15 languages. Next slide. Today, we're providing information, not legal advice. If you have a specific question about a patient, we encourage you to contact us through our hotline or our online form. Next slide. The subject matter I'm discussing today is rapidly changing in the current environment of both state and federal law changes. So a disclaimer that you have to remain vigilant, and I encourage you to stay connected with us. There's a way for you to sign up for our newsletter where we will share changes to public benefit eligibility, as well as share changes on considerations that impact an immigrant family's decision about their public benefits, such as changes to the use of this benefit information for immigration enforcement, the public charge rule, and other federal changes to immigrant and state changes to immigrant use of benefits. Next slide. We're going to discuss key impacts today. I'm going to focus on Medi-Cal, but I'm going to again share a few slides for you to reference about immediate changes in April to CalFresh, and also big changes to CalFresh in June, and then share some slides on data privacy and public charge. Next slide. So what are the changes to Medi-Cal that are happening or have already happened? Next slide. The biggest change is what is called the Medi-Cal enrollment freeze. Over a series of many years, California expanded access to Medi-Cal, which is the name for Medicaid in California, to include everyone regardless of immigration status. This was using state funding beyond the federal funding for Medi-Cal. However, as of January 1st, there is a freeze for some immigrants, and they are no longer able to sign up for full scope Medi-Cal. These are adults 19 and older who are undocumented and not yet enrolled. At this point, they can only apply for restricted scope Medi-Cal, which only covers emergency services, dialysis, and long-term care. Next slide. Who is impacted by this freeze? So we use the phrase undocumented, but it's kind of a term of art when you are talking about Medi-Cal, because there are some people who might think of themselves as undocumented, but under eligibility rules in California, they may actually be eligible for benefits. So the biggest groups of people who are undocumented who remain eligible are children, including up to 18 years. So 18 years and younger, so you become ineligible at 19 unless you meet eligibility rules or another exception. People who are pregnant and 1 year postpartum, that includes regardless of the way that your pregnancy ended. That's not something that the welfare department, DPSS, will know, so you have to inform them of that. and also foster youth and former foster youth up to age 25. So that's 25 and younger remain eligible for full scope. That also might not be something that the welfare department knows and that you have to advocate about. Next slide. Many immigrants remain eligible for full scope Medi-Cal. And there is a full list and a chart hyperlinked there, especially important for people who help folks apply and retain their benefits, that explains all the eligibility categories. I don't have a lot of time, but I want you to, note them here, that they are here, that before someone decides not to apply, or if you find that someone is having restricted scope, there are some errors that we've identified since the freeze happened. You might want to double check this chart to make sure someone isn't wrongfully being excluded from full scope. And I'm going to highlight a category called the Pru-Call catch-all category on the next slide. This is a category only in California public benefits law. We're focused on that. These folks are state funded. For people who have experience helping people get and retain Medi-Cal, you're familiar with the MC13 form. This is the last category on that form. It says that USCIS, which is the agency under Department of Homeland Security that doesn't enforce immigration, but helps people process their applications that they put in for immigration relief. USCIS is aware that you are in the United States, meaning you have some kind of pending application or application in process, and immigration is not taking steps or intending to deport you because of your status, individual circumstances, or a combination of both. So that could be a health issue, or other reasons that deportation is not enforced. You self-attest to this using the MC13, and you do not have to submit any actual immigration documents. So this is an individualized assessment. And again, if you have an individual question, that's a good referral to the BILA network. Next slide. So the biggest question we got and we continue to get is, did my Medi-Cal turn off on January 1st? And no one already signed up for Medi-Cal by December 31st, 2025 should have seen any impact to their benefits, regardless of the immigration status of that person. And regardless of whether if they were to apply today, they would be denied. Nothing changes. It was a freeze of new applications. And for the people already on, the rules held as is. However, we do continue to hear of situations where people are being switched to restricted scope, even though they were signed up for by December 31st. People might not know about this until they go to get care and they're denied the kind of care you would get with full scope. So again, be vigilant. And you can resolve this with Department of Public and Social Services. And if you're having issues, you can seek assistance from BILA. Next slide. But what happens if someone who's in that freeze population, the undocumented folks, over 19, not foster youth, no pregnancy, and don't fall into any eligible category? What happens if they were on by January 1st, so they're getting full scope, but they lose their full scope because of a failure to recertify properly, or they lose eligibility because of income? They have 90 days to get back on Medi-Cal. 90 days. If they don't and they reapply at a later date, all they will get is restricted scope. So it's very important that people understand their right to cure, to get back on in 90 days. Otherwise, they will lose this incredibly valuable benefit. These are all state law changes. Next slide. Another state law change to our expansion population and to people funded by state benefits is starting July 1st, many immigrants will lose full scope dental benefits and only get restricted scope, which only helps you once you have a dental emergency, which we know is not good medicine. That is what we have. So the message is to please review this chart. This chart that I highlighted has 3 columns. Who is not impacted by the freeze and who is, who's impacted by loss of dental and who isn't, and those are not all the same. And then I'll show you in a moment, there's a column for who's impacted by premiums in 2027. So the message is check that, make sure people are aware, and make sure that people are getting their dental care before July 1st, especially preventative care, which could be really helpful in avoiding dental emergencies. Next slide. Changes that are coming for everyone. This is a federal change that everyone needs to be aware of, is that in January 2027, not far off, two major changes are coming to Medi-Cal. Renewals for Medi-Cal for everyone will be every 6 months. We know that administrative burden is a leading cause of people not being on Medi-Cal, that churn from paperwork issues. We had a long time where people didn't have to do their recertifications during COVID. We know that people's health really benefited. Then we had a long time where we had waivers from the federal government to automatically renew certain people because of their consistent income source. Those waivers have ended. Right now, DPSS is processing over 100,000 Medi-Cal renewals a month, and that will be 200,000 a month. So without new staffing levels, so we can anticipate that there's going to be a crunch, a bottleneck potentially, that people are really going to need help. And remember, for the expansion population, if your recertification doesn't go through and you get terminated, you only have 90 days. So there'll be more trainings about this, but it's a really big impact on health that's coming. And another huge change we've never had before with Medi-Cal is work requirements. There will be a lot of trainings about that, but basically certain adults who are not otherwise exempt will have to participate in work 80 hours a month, or lose their Medi-Cal. There's a lot of work the county and health providers have to do to help screen people for exemptions to these, to educate people, and infrastructure to make sure people have access to resources to meet their work requirements. So more to come on that. There's a DHCS resource about these changes. Next slide. And in July 2027, I'm not going to talk too much about it now, but check the chart. Many immigrants, each adult immigrant will have to pay $30 a month to keep their Medi-Cal, which we all know is way more than people have lying around if they are in Medi-Cal. The age groups are a little bit narrower, 19 to 59 only, and people who are pregnant are exempt, but still will have a huge impact and cause a big loss of Medi-Cal. Next slide. So some key messages. There's still a lot of immigrants that are eligible for Medi-Cal, and everyone is still eligible for full scope. So seek out help and enrollment from trusted organizations. Especially if you're in your expansion population, keep up with your reporting responsibilities and cure in 90 days, and get your dental care now, because many populations will be losing full scope dental in July. Next slide. Again, I don't have a ton of time, but I want to let you know that CalFresh eligibility for immigrants is changing April 1st. This slide shows who remains eligible until April 1st. It's important to screen people for CalFresh. It's the leading food security source in our country and in our county. It's the #1 food security ensuring resource. So make sure people are enrolled, and then we have a bit of a crunch only until the end of the month. Some people will be eligible. Next slide. These are the populations that will remain eligible after April 1st, so review them. It's a little bit complicated. It's a combination of state and federal dollars again, of the CalFresh program, which is our SNAP program that's federally funded, and our CFAP program, our California Food Assistance Program. That's for some immigrants that lost eligibility in 1996. And unfortunately, our state did not step in and cover those folks who are losing eligibility now with the CFAP program, though we hope to see some changes in 2027. Next slide. These are the populations that will no longer be able to apply for CalFresh as of April 1st. You'll notice they're very vulnerable, humanitarian, status immigrants like refugees and asylees, survivors of trafficking who've been certified as survivors of trafficking. These are the folks that need to apply by April 1st. They'll maintain their benefits for a year until their next recertification. Next slide. The takeaways are that folks should apply by April 1st if they're in that red chart. There are some CDSS flyers, but I will warn you, they're a little confusing and they don't talk about CFAP very well. A big takeaway is also that all lawful permanent residents will remain eligible and continue to remain eligible. Those are green card holders. And if you sign up for the BILA newsletter, we're going to be releasing kind of easier to understand FAQ in the coming week, and you can use that while working with folks. Next slide. CalFresh work requirements are coming much sooner. They're coming June 1st, and people will have to comply who are not exempt with the 80 hours a month work or training or volunteer requirement unless they are exempt. Starting June 1st for new applicants, they will only have 3 months on aid and 36 months if they don't comply and they're not exempt. And for people already on aid, at their next recertification after June 1st, they will start their 3 months. And if they don't meet the work requirement or meet an exemption, they will be terminated. There are exemptions. I don't have time to talk through all of them. The BILA Network does plan to do an in-depth training, and the state is also doing a training, which I believe might be on the next slide, but this will also cause a lot of harm and food insecurity in our community because work requirements that have been implemented in CalFresh and other states, it shows that it mostly just leads to attrition and loss of benefits for people subject to them. Next slide. These are the webinars that I encourage you to join if you are interested in food security, helping people navigate the safety net. We know food is medicine, and without these critical benefits, many people will go hungry. Next slide. Some things haven't changed. WIC hasn't changed. Cash aid programs in our state haven't changed. So that's just something to be mindful of. Next slide. We're going to talk quickly about privacy in people's data when they apply for benefits. Historically, the use of the data that you give to the welfare department has only ever been used, regardless of the benefit, regardless of your status, only been used to verify eligibility. There's never been a threat historically to that data. Unfortunately, under the current administration, there have been multiple attempts with many major programs to access data either by telling states to give it to them or using the data they already have. So in Medi-Cal, the federal government is trying to use information that the state has to share because of its funding and just how things work for immigration enforcement purposes. There are lawsuits. They have not been that successful, and there is some limited data sharing right now. It's not clear what will happen next, and I don't have up-to-date information coming out about whether there's an actual tie to someone signing up for these benefits and an immigration enforcement action. We have an in-depth explainer on our website in the news section. Next slide. With CalFresh, the same thing was attempted, but that data is not given as a matter of course monthly to the federal government. They've been compelled, the state has been compelled to provide it. That lawsuit has been more successful. We don't believe there's been any data sharing up to this point. But again, none of these lawsuits are done, and it's unclear what will happen next. Next slide. So what is one to do? I'm telling you, tell people to sign up, do it by this date, keep your benefits. It's a really tough time as a healthcare provider to talk through these issues. The most anybody can do is have individualized conversations about the risks and benefits of using these benefits. It's important to know that if you are enrolled, disenrollment does not erase you from the system, although unfortunately over 100,000 people have already disenrolled from Medi-Cal in the past few months. And then it's also important to think, does Immigration Services already have all the same information somewhere else? And in that case, is there actually an increased risk? Again, this is an individualized conversation, but a really critical one to have because you're weighing, family safety and access to the most critical health benefits. Next slide. You don't have to share information about family members not getting these benefits, but they may know that it's a child-only case, so that's complicated. But it's also really important to remember that many immigrants who are seeking these critical benefits are not at high risk of immigration enforcement. See our privacy explainer there to have a better sense of how you would talk on an individualized basis with patients. Next slide. Public charge is a rule that's only used in some immigration processing applications. It's a ground of inadmissibility. The question is, will you become dependent on the government in the future, as evidenced by your use of certain public benefits? We have a rule from 2022 that's a pretty good rule, and it is still the rule, but recently the federal government has proposed a change to that rule. So we're going to go to the next slide. I could give you an hour presentation on public charge. I don't have that time. So I just want to point you to resources and give you like a very high overview. Public charge does not impact all immigrants. This is really important because the only thing that we know isn't going to change, even with the federal government changing the rule again, is the group of immigrants that are not impacted. So remember, public charge is a rule that's used in a certain type of immigrant application. That's a green card through a family-based petition. That's how it shows up in the US. Also shows up external, but we're focused on our patients sitting here in Los Angeles, okay? So first of all, if someone already has a green card, it does not affect them. It does not affect naturalization. It does not affect green card renewal. It doesn't affect green cards for people like survivors of violence who are adjusting their humanitarian visas. So there are a lot of people who are exempt. It's just in that narrow situation. And by the way, it doesn't impact an undocumented person who has no path toward a family-based petition, someone who could sponsor them or a feasible immigration application. The only people that should be worried right now, while we have uncertainty about what the changes will be, are folks who are pursuing a family-based petition. Public charge only comes up when you put in that application, okay? Or you're considering very soon to put in an application like that. Under the current rule, Medi-Cal, CalFresh, and most public benefits are not considered, but that's the threat, that the scope of the benefits considered could be expanded. On our website, on the public charge tab, you'll see what the current rule is. Next slide. No, I have no time. So again, we're the BILA network. We're a special project of Neighborhood Legal Services of LA County, where we have lots of amazing partners. Major FQHCs are the ones that most of the referrals that you send will go to for enrollment. We'll be the ones to provide legal support. And there are people out there pounding the pavement, trying to make sure immigrants have all the information they need to keep their families healthy and safe. These are our services. Next slide. This is our website that I keep talking about, and our hotline that Neighborhood Legal Services paralegals who are amazing and bilingual answer. Next slide. And that's it. So thank you for having me.
Thank
Happy
you
to
so much. Thank you
come
so much for
back with all the changes that are constant right now. It's really incredible.
Absolutely. There are so many constant changes. It's really hard to stay on top of it. It's lovely to know that there are strong expert advocates in the community we can turn to. Just as a reminder, these materials will be posted on our website and mailed out to people. So if you want to dig in a little more deeply, of course, you can also visit the website and make a phone call. Do we have any questions in the room? And we are running a little tight on time. So if you have questions, let's please keep them tight. Thank you in advance. Questions in the chat?
Yes, we have a question from Lena. What if folks cannot find work to meet the work requirements? Also, how would they verify employment?
Great question. So the way, and again, I encourage you to go to those trainings. We will offer training. We'll offer trainings in Spanish in the next few months. So this is not your only time to learn about work requirements. But the unfortunate thing about the way work requirements will be implemented, likely in Los Angeles, it's really different than CalWorks, if you're familiar with the Welfare to Work program. There's no help that's promised to you. We have to do our best in LA County to identify places people can go, like work source centers, which are run by the city, America job centers that are run by the county, and other nonprofits that provide specialized employment services and training. So we just have to work together. I encourage the Wellness Center to be a resource for that, where people can come and get that assistance and what it means to meet the work requirements. But what I think is most critical, because you all are healthcare providers, is that you are a place that really understands the importance of not letting anyone slip through the cracks who has any health condition that makes them unfit to work, which is not completely permanently disabled. It just means it's really hard for this person to work that amount right now. Maybe they're getting over an illness. Maybe they're recovering from cancer. Maybe they're suffering from depression. And while they might be able to do a little work or search or whatever, it's too much stress and it's too hard for them. It's not fair to treat them the same as anyone who's completely able to work. So any health provider of any certification can verify that. And then there will be more information coming from the county about how to verify employment. There'll be forms, there'll be just your proof of income, you should be able to write it. There's lots of different ways that you'll be able to verify employment.
Great. Thank you so much. With that, we are going to conclude this portion of our presentation today. Again, thank you so much, Lena, for joining us and sharing such an excellent presentation. We're going to take a couple-minute break, about a 3-minute break, I think, to allow our interpreters to take a deep breath, rest their voices for a moment, and we'll bring our next presenters up, which are going to be from Metro. So take a few minutes break, go get yourself some coffee, get yourself a snack, and we'll start again in a few minutes. All right. Well, welcome back, everyone. We're going to go ahead and get started on our next presentation. We're very excited to have colleagues from Metro coming forward to talk to us about the Metrolink commuter rail project that's going to be happening and servicing this campus. Very excited to have the rail lines have a station here at Los Angeles General Medical Center. So thank you, interpreters, for rejoining us. And with that, I'm going to turn the microphone and the podium over to Rosalba, who will walk us through this incredible project.
Good morning, everyone. My name is Rosalba Gonzalez. I am the Community Relations Manager for this very amazing project that is coming to what I call the intersection of the Northeast Los Angeles area, where East LA, Boyle Heights, and Lincoln Heights kind of all intersect into one. Before I get started, I do want to take a minute to thank our hosts, Heather Hayes and Christina Cardenas, for welcoming my team to this meeting. I know that you have a busy agenda, so I will try to keep this presentation short. But I also wanted to thank my team who is here. Alondra Lopez, who is our Principal Community Relations Officer. She assists our project with outreach. I also want to thank Jacqueline Bobadilla. She is part of our consulting team at NSA, North Star Alliance, who has helped build the community outreach in all of these communities. So I want to take a minute to thank everyone for that. So what is this project? This is the Los Angeles General Medical Center Metrolink commuter rail station project. Next slide, please. We'll go one more slide. So let me provide a quick agenda for this presentation. We'll do a couple of welcomes and introductions, go over what the project is, go over the environmental and engineering reports that we have received and what we have done out in the community, followed by a quick Q&A. Next slide, please. Oh, I think I'm able to do this on, oh, no. Okay, thank you. So about the project location. So how many have used the Metro or the El Monte busway to ride the J line, to ride Foothill Transit out of the LAGMC busway bus stop right across the visitor parking lot, lot 9? Can I see a show of hands? I see one. So This proposed rail station project is going to be located adjacent to the station along the Metrolink rail line. This area, again, is serviced by the Metro J line, the Foothill Transit, LA Dash, and it serves key locations in this area. It connects people to LA General Medical Center, where we're standing here now, Adventist White Memorial, USC Keck Medical School, Bravo High School, East LA Occupational Center, all key destinations for this community. Next slide, please. So what Metro has proposed is to build a Metrolink commuter rail station station at those tracks. And this is where it would be located. So like the LAGMC stop is right next to it. So it would provide additional improvements to ensure safe and convenient passenger access to and from the station. And it would build a new pedestrian bridge with stairs and an elevator to connect the station to the street level. Next slide, please. So who has used Metrolink before? Or who knows Metrolink? So Metrolink is a regional train service that connects neighborhoods and cities, helping people travel longer distances to major destinations. It goes through 5 different counties, maybe even 6, from San Diego all the way to Ventura County, San Bernardino, and Riverside. So next slide. So these are the existing conditions and why it is the ideal location to create a new station for Metrolink. First of all, Metro owns the right of way. So this is Metro property. 2, there is the space to build this station. So you see the 2 rail lines train tracks that Metrolink currently uses for the San Bernardino line. But there is this faint little train track that is a service rail line that Metrolink uses to do maintenance on the line that can be used to create an additional train track. So these are the existing conditions that make it an ideal location. As you can see, it's right behind the parking lot number 9. It's an easy connection to the hospital. And then on the other side, it's a short 20-minute walk to Adventist White Memorial. So it's an ideal location. Next slide. So how did we get here? In 2022, Metro conducted a feasibility study. What did we evaluate when we did this back then? We found that it would provide reliable transit for essential workers and visitors to LA General Medical Center. It is a prime institution for research. It brings patients from across LA County and beyond. It improves mobility for nearby residents and enhances regional rail connectivity for those in this community. So Metrolink can open the doors to different locations for the community without needing to have to take a car. It supports the redevelopment into a health innovation district with better local economic opportunities. We have estimated that the ridership by 2045 would be 850 weekday boardings and approximately 100 to 150 weekend boardings. That may change depending on our population. Next slide. What are the anticipated project benefits? And I think I've already shared a few of these, but key is improving the air quality and safety and reducing traffic in this area, improving access to this hospital, enhance transit connectivity for all, and enhancing economic opportunity to the area. Next slide, please. So in the environmental studies that our technical team conducted, Metro was looking at the impacts for air quality, noise, hazardous materials, traffic transportation. Next slide. And this is what we found. We found that the project was consistent with the local planning and zoning. It's located in an existing urban area, and it's surrounded by current development. So we found that there was no significant impacts to sensitive environmental habitat, including traffic, noise, air, and water. Next slide. So I will share a few details about the engineering layout, what is being proposed. There would be a center platform. The green would be the bridge that would connect the platform to the street. The purple is the emergency egress for this rail station. Again, this would only be used for emergency purposes. The main and only entrance would be the bridge. Next slide, please. And I will show a few renderings of what this would look like. None of this is a final design. This is just for visual purposes. As you can see, you can actually now see like what the emergency exit would look like, what the bridge would look like, and the platform. Next slide. And this would be a ground level view of what that would look like for us. And as you can see the El Monte busway right next to it. Next slide. This is the street level view of Pomeroy, just behind the visitor parking lot. As you can see, there are a lot of improvements that have been made, changes that were done to the bridge connections. We would maintain the bridge to the busway and create a new bridge to connect the train station. And then there are art possibilities along this area, and it would also be a mobility hub. There are buses that pick up here. I think LAGMC has a shuttle that stops here to bring patients into the hospital. And then there is a possibility for a bike share to be there as well. Next slide, please. This is another view of the street level at Pomeroy, and the tremendous opportunities there are for pedestrian safety and connectivity. Next slide, please. This is going to be a very quick video of a simulation of the, let's see if it plays. If not, oh, is it the PDF? Oh, sorry. I thought we had sent the PowerPoint. My apologies. We'll go on to the next slide. We'll share the video with you guys as well. So what are the preliminary costs? The cost for this project is approximately 100 to 150 million, which includes contingencies to build the station. That cost includes the platform, the removal of the second track and improving the third track, building that new pedestrian bridge and elevators, and making improvements to Pomeroy. I will be frank with you, there is no funding identified currently for that next phase. Metro is exploring all of the possibilities and the future funding opportunities that may be available for this project. But in order to get there, we do need to do this work to have this project what you would call like shovel ready if the opportunity presents itself. Next slide, please. So I wanted to talk a little bit about the outreach that our team has done. I'm very proud of the outreach that we have done in the short amount of time that we've had this project. So we've gone door to door, we've gone to local businesses, we've engaged community-based organizations, including working closely with Avance Latino and the YMC Weingart. We hosted a community survey, collecting 556 community surveys. We touched about 7,700 community stakeholders along the way, whether it was through our pop-ups, whether we were at train stations at Union Station, El Monte Station, just connecting with transit riders, with the community. We did several pop-ups here at the LA General Medical Center, connecting with those who work in this community. We actually, the last time we came to visit LAGMC, we ran into a worker here who had seen Alondra and actually took the survey. So we were happy to see that. we'll share a few pictures of what that looked like. As you can see, our team engaging, a few shots of LAGMC here and there. We did writer outreach at Union Station, Cal State LA, El Monte, and sharing a little bit about what we heard throughout our community touch points or in our survey. Next slide, please. We know that this community is heavily transit dependent. 51% of those that we talk to use Metro, whether it's the bus, the rail. 29% use Metrolink. 13% use LA Dash. Next slide. How do people use transit? So the vast majority are using it for day-to-day things like shopping, getting to school, visiting friends. They come here, they work. So these are key things that we wanted to hear from the community and how this resource would be used. Next slide. And then the key question that we wanted to know from the community is how likely they would be to use the station. And overwhelmingly, we had a very, very likely high chance of using this Metrolink station. So we were very happy to hear this and being able to share this with the community and with hopefully soon the Metro board. Next slide. So this is our project timeline, where we're at. We are completing this part of the study at this time. We're closing out our outreach soon, getting final feedback from the community. Once we close out this portion, we will be reporting to the Metro board on the results of the study, including the technical studies that were done by our planning team. And we're going to be continuing to coordinate with key stakeholders and just keeping the word out on this project. Again, there is no funding identified yet, but if it's for our best to keep this going and making sure that if we need to go further and get more in depth, we can do so and complete the project and get to 100% design soon. Next slide. And I think this is an opportunity to do Q&A if you have any questions.
So to be clear, this is a new Metrolink station because the nearest ones are Union Station and Cal State LA.
Yes.
Is that it?
So if they wanted to come to LAGMC or to even Adventist, they would have to get off at either Union Station or Cal State LA and then get on a separate bus. This would be a direct link to this hospital and these resources.
Yeah, that would be great. And I'm in traffic right along that every day. There's a big exit to Soto and there's a big exit on State. So people are coming to this area from far. So I look forward to that opportunity.
Hi, I don't know if would be applicable at this point in time, but have you been hearing through your outreach about concerns about safety, visibility, even when it comes to like commuters who have to travel from far early in the morning or late at night, and how are you tackling that?
So currently, anything that's like now, we are sharing with our team and those who can make the changes possible for the area. The bridge itself that connects the current busway, there are different issues there that get resolved, but the Metro team is working on making some changes there. But for this specific project, we know that safety is a concern. If you saw the renderings, you see the stations, there's more lighting, there's more, and there will be improved lighting along the street. So all of that and all those improvements make it for an area that is more accessible. There will be a lot more people there. So that kind of deters any of the other issues, that safety concerns that you have, because the more people are present, the less likely you are to have trouble. All right. So the last slide includes our contact information. We are happy to hear from you throughout this process. If you have questions, our project lead is Mr. Jay Furman. I know he has presented to this group before, and our contact information is 213-922-2550. If you have any questions, that's the best way to reach us. Email is also a great way to connect, LA General Medical Center at metro.net. So with that, I will hand it back to Heather. Thank you so much. We really appreciate connecting with all of you.
Yes, thank you so much, Rosalba. We really appreciate our presentations from our colleagues at Metro. And this is, again, an exciting project. I know we're all going to really benefit from this. So thank you again for coming forward and sharing the hot off the presses news with us. And with that, we will move into our final presentations of the day. We're having some updates on our restorative care village projects that are going up actively on this campus. I just drove by Restorative Care Village Part 4, I believe, and the doors look like they're ready to open. It's so exciting. So anyway, I invite Parisa Dadmehr from the Los Angeles County Department of Public Works to come and share with us where we are at. Parisa, so exciting.
Good morning, everyone. I'm Parisa Dadmehr with Public Works Project Management. I oversee the projects, construction projects over at LA General Medical Center, and happy to be here to provide some updates on the Restorative Care Village projects. Next slide, please. What you see here is Restorative Care Village Phase 4. First floor is the Mental Health Urgent Care Center, and the second floor is residential withdrawal management facility. And happy to actually announce that the first floor is operational. They just moved a couple of days ago, so we're very excited to see clients coming through. So Exodus has moved in. And they're working on licensing for the second floor. So within the next few months, that should be operational, hopefully as well. Next slide, please. These are just some interior photos. It was taken prior to the move, just to give you a feel of what the building looks like, the interior look. Next slide, please. We're going to move to RCV 5, which is in construction, and that's the psychiatric subacute facility. I've just listed some activities here just for an update. We are currently working on interior work. We have completed rough mechanical, electrical, and plumbing work for all stories. And we have also purchased the switchgear and generators, and they are currently sitting on site. Those are some long lead items, and we're just happy to know that they're here within reach. Exterior roofing and metal panel installation is ongoing. If you happen to drive by Mission, you are going to see the colorful panels that have been installed. So the building is beginning to have a more complete look. We are also working on installation of the drywall in all floors on the interior side. And we are on track for completing the schedule August of this year. So we're very excited about that. I also wanted to just briefly mention the numbers for local worker and targeted. We are at 15.4% for targeted worker and 42.3% for local worker, which is a really good percentage. The requirement is 10% for targeted and 30% for local worker, and we are exceeding that. So we're very happy about that. Next slide, please. I have just included some photos here for you to see the progress on the construction. We have a full force going on. That's just the exterior. Next slide, please. And these are some, this is a photo from the roof. Next slide, please. And here just you can see that they're hard at work, trying to meet the timeline. Next slide, please. This slide basically is showing you a little bit of what's going to happen on the interior. And this is showing you the lobby. We have 6 separate pods with 6 separate providers that are going to be operating this facility. And we figured it would be a good idea to provide some wayfinding signages. And we have done that through what you see on the screen, some floral um, patterns that are going to identify each of the sections. So you see 6 intake areas, and each of them have their distinguished what we call wayfinding. This will also continue on as you go to the next floors. Next slide, please. So this is just a larger version of what they look like. We've tried to use calming colors, beautiful flowers to create a home-like environment for the visitors, for the clients. Next slide, please. On this slide, you're going to see a more detail on the wayfinding, which is what you're going to experience as you take the elevator up to second floor. So on the second floor, as you enter what we call the lobby, which is right off the elevator, these are the photos that you're going to see. So these are going to be more like artwork, but what we call it wayfinding. So if you have registered on the first floor lobby in a particular pod for a particular provider, you're going to be able to see it as you go to the second floor. Next slide, please. Similar situation here. So this is for wayfinding for the next floors, 3rd floor and 4th floor. Next slide, please. I'm very excited about this one. So this is showing you a location pretty much in the corner of Zonal and Mission that belongs to City of LA. And we have been working with the city to pull a permit to be able to do some development. Unfortunately, city doesn't allow us to install any permanent structures in this area, but we are able to provide some landscaping and some concrete walkways. We have been able to identify one element in the concrete walkway, which could really use some input from community. So we have been working and are continuing to work with the HICP co-design committee to come up with 5 coats that we could basically place here on the concrete. It would be laser cut, and it would be something that would be permanent, that would be there, and it would signify basically the facilities, the new facilities. So we're hoping to come up with 5 ideas, and hopefully by next month HICP meeting, we'll be able to put that out to vote and see which ones you guys prefer best. And this could be anything inspirational. It could also be anything related to memorializing the old Women's and Children's Hospital that was demolished. So we're open to any ideas and hope to get your input on that. Next slide, please. This is just some timeline for you guys. For phase 4, we had awarded the contract in 2023, December of 2023. We started the construction summer of 2024, and we had that completed by November of 2025. And we hope that the full building be operational by fall of 2026. For phase 5, contract was awarded in July 2024. Construction started January 2025. We are hoping to complete by August of 2026. This one had a super expedited schedule, and we're hoping to have the licensing completed and have it operational by winter of 2027. I believe that concludes my presentation. I'll be happy to answer any questions.
Thanks, Parisa. Yeah, I just drove by the Restorative Care Village 4 and I was like, oh my goodness, it's open for business. It looks beautiful. I encourage all of you who have spent some time on this campus to go check it out. And of course, Restorative Care Village 5 going up right behind it. Do we have any questions for Parisa? Great. I know you keep us regularly updated, so I'm not surprised we're on top of it.
Thank you.
But thank you so much, Parisa. We'll move forward with the next presentation, which will be online. Iris Anna Regn from the Los Angeles County Department of Arts and Culture is going to do our next presentation. Thank you for joining us, Iris.
Good morning. Yeah, I drove by RCV 5 yesterday, and it's incredible. And it's also incredible the way it integrates with the previous phases of the Restorative Care Village. Very quick update here. I wanted to show some images of Stephanie Mercado, the mural artist's process right now. I'm not allowed to show sort of full things in work, but this is so fun and so meaningful. Here's a little snapshot of her studio. She works both in block printing and also in painting and collage and sort of in different ways. And you can see what a block print is on the right-hand side. So she literally carves these by hand and then she prints, and she's been experimenting with colors and with adjacencies. And next slide, please. And I wanted to show something that is a symbolic interpretation that she's working on of something that's really meaningful. So this nurse is a stand-in for the care at the Women and Children's Hospital. And so she's nodding to just this idea of nurturing and care in this way, and also in terms of sort of the larger sort of caretaking and healing. And you can see, so this is this very intricately carved block, and you can kind of imagine the kind of work that went into it. You could see her hand, the parts where she was actually carving. This is a print on the right, sort of an experimental print of how the outlines are going to turn out. Next slide. And here she's experimenting with colors, and you can see all like she's got a lot of different blocks, and she's working with them and trying to figure out sort of how things work with other things. So this is going to be, this is one portion of the mural that she's working on. And so you can imagine the level of intricacy and detail and symbolism that is going into this artwork. So this is just one level of experimentation. And, here the outlines aren't put on. I wanted you to see the colors, but I wanted to share that because I thought this was particularly touching and gives you an idea of how she's working right now. I wanted to thank anyone who was able to help complete her survey, and also for you to know that she's doing a bunch of other community outreach right now, and she's working on flyers for them, which I'll share with HICP as soon as I have them. But just for everybody's awareness, so on March 13th, from 5 to 7, she's holding a workshop in Montebello at a place called Metzli Projects. And sort of closer to the campus, there's an organization which is really amazing called Latinx Plants. And she's holding a bandana printing and bandana drawing workshop that's open to everybody on the 16th from 3 to 5 and on the 17th from 3 to 5. I will be there on the 16th. And then on top of all that, she's hosting 2 closed block printing workshops at Terasaki Budokan in Little Tokyo. And these are geared towards children. And she's also trying to incorporate seniors at that center. So she's really getting information from, different kinds of information from all sorts of areas. But definitely the workshops on the 13th, the 16th, and the 17th, she is just finishing her flyers on that today, actually, and we will send them out on Monday. And so hopefully this is something that you all can help us share. And then also know that space is not going to be infinite, and she's going to hold additional workshops after her mural is completed. So if you can't make this, there'll be more afterwards. Thank you. And please feel free to ask me any questions.
Thank you so much, Iris. We're
Yes,
always so
social
delighted to
literature.
have all the art be joining us on our campus. So there's a quick question in
Yeah,
the
it's a
chat about
really
social
good
media.
question. Okay, I'm looking it up right now. And actually, Latinx Plants has and I don't know if you've ever been, but it's this wonderful shop that is continuing in the sort of healing traditions of plants, but all sorts of different kinds of plants. And then they have a workshop space in the back, and they host workshops. And they also invite other artists to do workshops. And then they have an outdoor area that also can host workshops. I mean, it's an amazing, very local organization if you haven't been. So that's called Latinx Plants, and they have an online presence. And then Stephanie, let me
Fantastic. If you have those to throw in the chat, please
I
do so,
will,
Iris.
yes,
Really appreciating that.
yes,
And if we can
absolutely.
look up
Just have to look
Latinx
it up.
plants and throw that in ourselves, if we can find it, that'd be great.
Yep, I will do this.
All right, wonderful.
Thank you.
Yeah, thank you again. I think we're always so delighted to see such beautiful, colorful, inspiring works of art that lend itself to the healing journey of this campus. We really know that art is part of the things that feed the soul, and we need that as well as the wonderful, excellent medical care and community services we provide as well. With that, do we have any additional questions or comments for Iris? Oh, I have a comment in the room.
Could you repeat the name of the artist?
Yes. So this is her, yes.
So the artist's name is Stephanie Mercado, and I think we're getting some notes in the chat. But yeah, Stephanie Mercado is her name. She's also one of the artists that has been featured here on the campus in the past. So she continues to bring incredible projects to our space.
And she would love it if you followed her, because part of her professional growth is also building her online following, right? This is all what an artist does now. So I know she'd appreciate it.
Yes, yes. Thank you for making that note. She is definitely someone well worth celebrating. Here we go. That is Stephanie Mercado. All right. Well, we are almost at time, but we do have a few quick announcements we wanted to make. So I'll ask Elijah to pull up some slides for us. And Iris will continue to populate the chat with some other contacts. Again, please do, celebrate the artist as well as the artwork, and you can follow them online. So here we are, the month of March. We have a few partner announcements we wanted to share out with you. The first is that we're very excited at the Wellness Center and the Los Angeles General Medical Center campus to announce that we have a partnership with LA Opera, and they are going to be on site bi-weekly to host a community choir singing class. It's open to all 12 and up. No musical experience is necessary. It will be hosted on Mondays from 10 to 11 in the Wellness Center. Please come join us and get your sing on. So we hope to see you there. The first session will be this coming Monday, March 12th. It'll also be March 23rd, and then we'll be doing bi-weekly into April as well. Next up, the Wellness Center, in partnership with the Keck School of Medicine at USC, will be hosting our annual Diabetes Day. This is a learning program for those with diabetes, with pre-diabetes, or those concerned about a loved one who may be struggling with diabetes. Come join us for a half day of programming, exercises, information. It's always a wonderful event. We think this might be about our 10th anniversary of the Diabetes Day, so come out and join us. That will be on Thursday, March 12th, this coming Thursday, 12:30 to 3:30, also at the Wellness Center. And finally, just a quick reminder that March includes March 31st is honoring Cesar Chavez, and both the county offices as well as the Wellness Center and many of our partner organizations will be closed that day. That is Tuesday, March 31st. So just a reminder there. And I think with that, we are concluded for the day. 3 minutes short of our scheduled ending time. I gift you back this amazing set of 3 minutes. Please go do wonderful things with them. But anyway, we do look forward to seeing you again in 1 month's time, Friday, April 3rd. We will be right back here in this space and online again. So I'm looking forward to sharing space with you then. Have a wonderful month.